I'm Kitty Torila, and I'm the Interim Director of the Peter Underwood Centre for Educational Attainment here at the University. Now, as we turn to this important discussion, I would first like to acknowledge, on behalf of the University, the deep history and culture of this island. Today, we are broadcasting from the Medical Sciences Precinct in Nipaluna, Hobart, the traditional and original lands of the Muwinina and Palawa peoples. We pay our deepest respect to elders past, present, and emerging, and those who did not make elder status. And we acknowledge their deep history of storytelling, of knowledge sharing, and of caring for country. They would have gathered beneath Kunenyi to share health knowledge and to look after the futures of their young ones, just like we do today. We also acknowledge that colonisation and discriminatory policies have had a negative impact on Aboriginal and Torres Strait Islander peoples, communities, and cultures. And this has negatively affected the health and well-being of Aboriginal and Torres Strait Islander people. So, for example, for people who were born between 2015 and 2017, the Closing the Gap report tells us that the estimated gap in life expectancy between Indigenous and non-Indigenous people is 8.6 years for males and 7.8 years for females. We must close this gap, and health literacy can be one of the tools we can use to help achieve that. So I'd like to sincerely welcome each and every one of you, online and in the room, to join us for tonight's Island of Ideas lecture, Developing Health Literacy in Tasmania. The Island of Ideas series began in 2020 as a way of connecting our community with ideas and with innovations when we weren't able to come together face to face. And the program continues in the hope that we can connect Tasmania's community to people across the regions and globally. And tonight's talk is really close to the heart of many at the university. Our speaker is a cherished university graduate and has extraordinary academic credentials. Dr. Rosie Nash is a senior lecturer in public health at our university, and she is internationally recognised as an expert in health literacy. While she was waiting to travel for her Churchill Fellowship, Rosie invited her international peers to contribute to her book, Global Perspectives on Children's Health Literacy, Intersections Between Health, Education and Community. Now, this book will be published in 2024, next year, so keep an eye out for that one. And on her Churchill Fellowship, she visited the World Health Organization headquarters in Geneva in Switzerland, as well as colleagues in England, Northern Ireland, Ireland, France, Denmark, Germany, Norway, and the Netherlands. And my accent should be a bit of a giveaway. No surprises. I'm particularly pleased, Rosie, that you got to fit in the Netherlands as well. Now, only last week, Rosie returned from further travels, collaborating with researchers in Taiwan. So we are incredibly lucky to have such an international star here in Tasmania. Rosie is an innovator and a collaborator. She is a change maker, and she is a passionate advocate for Tasmania and its children. I'm sure that you will discover this tonight, and I hope you will leave this space as inspired as we were the first time we encountered Rosie and her work. To deliver the talk, Developing Health Literacy in Tasmania, please welcome Dr. Rosie Nash.
Thanks, Kitty. So tonight's presentation, as Kitty said, is Developing Health Literacy for a Better Tasmania. So I wanted to acknowledge here some key people first before we commence. So we have a Health Literacy and Equity Research Unit at the University of Tasmania, which was established probably 5 years ago. I want to acknowledge the work of the whole research team. So many of the PhD candidates are joining us here tonight, and without them, this work wouldn't be possible. I also want to thank the Winston Churchill Trust for the funding that made it possible for me to travel overseas earlier this year, and I'll delve into some of the recommendations a little bit later from that work. And then finally, I want to introduce Health Lit for Everyone, which is a social enterprise which is dedicated to health literacy, supporting health literacy communities, and I'll give you a little bit more on that later. So with all good presentations, I'd like to start with an overview. So in order to help others in the audience who may be less familiar with the term health literacy, and also those who are familiar with the term health literacy, I will define health literacy. There are hundreds of definitions of health literacy, so it's helpful that we're all on the same page, I believe. Secondly, I'd like to explain why it is so important. Then describe health literacy and Health Lit for Kids and why we focused on children and adolescents here in Tasmania. Next, I'd like to share with you the Churchill Fellowship motivations. So why did I go on that Churchill Fellowship in the first place? And then the question that I asked of my international peers. Then to present the findings and recommendations. Some of you here are the first to see these recommendations. And then to explain why health literacy then is important for a better Tasmania. So as I said, there's hundreds of definitions of health literacy. And interestingly, in talking to colleagues in Germany and also in Denmark, when we translate the term health literacy, it actually is health competence in those countries. And so this makes sense to me. Health literacy or health competence is much more than just being able to read or write information about health. And so the definition that resonates best with me is the one that I've shown here on the screen. And that is that we have the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about health. Health literacy then also includes the capacity to communicate, assert, and enact these decisions. This is how I think about health literacy, but I do acknowledge people in the audience might define it differently and see it differently to me. But health literacy is much more than this. Health literacy is an interacting, complex construct. In other words, it involves lots of moving parts. So here on the screen, you can see that health literacy can be described as an onion. There's a fancy word for it. People talk about this social ecological model of health literacy, but let's just talk about an onion. In the middle of the onion is the individual. So they have health literacy assets or not. The social supports and community around them can provide what we call distributed health literacy. They can see for them, help them, provide assets for them if they don't have them or possess them themselves. Importantly, our health services, the next layer of that onion, or our community services, or even our schools, they can choose to be health literacy responsive or not. And so, as you can see, there are many elements and moving parts, actors and factors that make up this complex construct that is health literacy. And finally, as with all good public health initiatives, health literacy needs to be embedded in and thought about in policy. And I'll talk more about some of the policy that we see here in Australia in a moment. So in public health, we like to talk about 3 Ps. So these are health promotion, health prevention, and health protection. Health literacy is essential and needs to be embedded in all 3. When you think about the COVID scenario, health literacy was front and centre, wasn't it? Those in our community who didn't possess health literacy or didn't have social supports that could provide distributed health literacy, or were trying to access services that weren't particularly health literacy responsive, they missed out. They were challenged by the circumstances. So I thought it was helpful to also share with you some of the key policies where health literacy have been considered, just to impress on you the gravity and the importance of health literacy in Australia. So Australia has a national preventative health strategy. Currently, Professor Don Nutbeam and his team are working on a national health literacy strategy, which will sit below this national preventative health strategy. This strategy, the National Preventative Health Strategy, it explicitly references the importance of health literacy. There's one example of where we've acknowledged in Australia how important health literacy is. For those clinicians in the room, you might be more familiar with the Australian Commission for Quality and Safety. They explicitly outline the importance of health literacy and how medical doctors, nurses, pharmacists need to be thinking about health literacy in their practice. And as per my earlier onion, we have individual health literacy and the responsiveness of those health literacy environments reinforced there. So Tasmania was one of the first states in Australia to have its own health literacy action plan. I'd have to say we punch above our weight in many areas, and this is one where we have to admit that Tasmania is doing well. And this is evidence that our government recognises the importance of health literacy in our public health efforts. There are a number of priorities and visions that have been outlined in that health literacy action plan, and also some notable initiatives, one of which is Health Lit for Kids. Health Lit for Kids was born here at the University of Tasmania in the College of Health and Medicine. It's a really important program that aims to develop and support the development of children's health literacy. I'll give you a little bit more on that later. In addition to the Health Literacy Action Plan, the Healthy Tasmania Strategic Plan also outlines that we need to focus on health literacy. It talks about specific health literacy actions, including building on organisational health literacy across sectors, developing the health literacy skills of health, education and community workers. Lo and behold, developing the health literacy in children, particularly in schools. I'm emphasising this point. We should be using tools to measure health literacy and thinking about implementing community-driven solutions. So that comes back to that onion, doesn't it? We think about all of these things, we're covering off and making sure that we can support the development of health literacy here in Tasmania. So why is health literacy so important then? Why do we care? Well, you can see here on the screen, there are a number of determinants of health. Unfortunately for some of this, these are upstream and outside of our control. These determinants of health can influence our opportunities and our behaviour. So these determinants of health may be social, commercial, environmental. There are a number of determinants that can drive and influence the development of risk factors. So these risk factors that we think about: diet, physical inactivity, smoking, alcohol, air pollution. These risk factors can then lead to these chronic conditions that we see in our community. So over time, these determinants may drive these risk factors, which then results in the development of chronic conditions such as heart disease, stroke, diabetes. So what does the Tasmanian health data look like? Half of Tasmanians experience chronic conditions. 1 in 10, or fewer than 1 in 10, Tasmanians eat enough fruit and vegetables. Fewer than 2 in 10 Tasmanian adults meet their physical activity guidelines. And when it comes to things that are specific to health literacy, 1 in 10 Tasmanians have difficulty understanding health information. Further, close to half of all Tasmanians report difficulties in accessing health services. I'm not painting the best picture, am I? And when it comes to our kids, Tasmanian children do not do enough physical activity. And we know in Australia, 1 in 4 children are obese. So my international colleagues have recognised that health literacy is a determinant of health. Do you want me to say that again? Health literacy is a modifiable determinant of health, something we can control. And if I still haven't convinced you of the importance of health literacy can determine one's health outcomes, educational attainment, which I think Kitty will be interested in, social equity and productivity. Okay, well, in addition to that, developing the asset of health literacy earlier in the life course, so for our children and adolescents, is likely to lead to better adult health behaviours. Gosh, it would seem a no-brainer to me that we invest in our children, wouldn't you say? So 9 years ago, Associate Professor Chandel Elmer and I, we sat at a learning and teaching event at the University of Tasmania, sat down next to each other. The universe brought us together. We started talking and we realised that in Tasmania, there were plenty of resources for adults, but actually there wasn't anything for children. And then when we looked further afield, we realised there wasn't much happening in the rest of Australia either at that stage. And apart from my lovely colleagues in Germany, there wasn't much being done internationally either. So this was 9 years ago. We developed this program called Health Lit for Kids. Health Lit for Kids is a flexible, whole-of-school approach that supports schools to develop a school environment. So it's important that we go with a whole-of-school environment to support health literacy for the children. It builds teacher confidence and competence to deliver health literacy in the classroom. A lot of our research has shown that the teachers don't feel confident or competent to tackle health topics in the classroom. Often health's being left. Health and PE is being left and health's being left. So it's double marginalised. Health Lit for Kids also provides students with a voice, an age-appropriate voice, so that they can participate in the health literacy development journey. And then finally, it aims to share health messages and learning with the wider community. So the children share their learning with the community through expos and parental involvement and the wider community. Importantly, Health Lit for Kids wasn't just made up out of thin air. We co-designed this program with our pilot school, refined it, and used the literature to inform the evidence-based to ensure the program was developed appropriately. So our team has been highly productive and managed to publish over 16 academic papers, which includes both the design phase and also the evaluation of our program. And this is from the perspective of not just the children, but also the parents, the principals, and the teachers in the schools. We also have data that looks from a quantitative point of view at the whole of school impact, as well as individual teacher experience. In addition to this, Health Lit for Kids has been recognised for its contribution to the prevention and control of chronic conditions or non-communicable diseases in 3 World Health Organization reports now. And we would like to gratefully acknowledge the funding and support we've received to date to enable us to do this research and also to deliver this service or deliver this program in schools in Tasmania. However, there's always a however, isn't there? Along the way, we've recognised that health literacy and our work has been placed in unhelpful silos. This is no one's fault. It's just how the government systems tend to work. And so this got me thinking, how are we going to help address this problem? So I applied for a Churchill Fellowship. And the question that I wanted to answer was, is health literacy a health, education, or a community issue? So I'll say that again. Is health literacy a health, education, and community issue? So on my Churchill Fellowship, I met with colleagues in Europe to ask them, did they encounter these same silos? What did they do to address this? What insights can I take back to Australia? And what collective action does the health literacy community need to take? My international peers, what can we all do together to address this problem? So as Kitty said, the Churchill was awarded in 2020, and I was fortunate to travel in May, June, July this year. And so I was able to meet with many of my international peers who are now called my family and friends, my health literacy family and friends, and they're in regular contact with me. So this Churchill was a bit of a whirlwind. 9 countries in 8 weeks. I met with 485 experts, recording 4,223 minutes of audio from my meetings with them, and there was many more offline meetings as well that I didn't record. I had 4 questions emerge from my 1 question that I posed to them in the first place. I've made 6 recommendations and 15 practical solutions that I'll share with you this evening. Most importantly, I only missed 1 flight and I only lost my baggage once. So I think we can say that I was winning there. So while I was there, I was really fortunate to visit the World Health Organization headquarters in Geneva. I only expected to go there once, but actually I got a call up on the last day that I was leaving to fly home to say, we'd like you to come back in and meet with another director. So the 2 directors that I met with, so the one shown on the screen at the top was Trinette Lee, who is the Director of Healthy Settings, which includes the health promoting schools. I was also fortunate to meet with Nicole Valentine, who is the Director of Social Determinants of Health and also the Health in All Policies unit. Both challenged me academically, asked me some really great questions, and some of the questions they asked me have really informed the way that I formulated my report and the recommendations that I'll share with you. Another trip highlight was presenting to the Dutch Health Literacy Alliance. This alliance recognises how important health literacy is to their country, and they have 150 member organisations, not just 150 people, but 150 member organisations. So I was really fortunate to present to them and to have the presentation live streamed so that others could join. So what did I find? Remember that question? Is health literacy a health, education and community issue? Well, yes, of course it is. Health literacy is everywhere, said a colleague from the Public Health Department in France. This workshop participant from the Dutch Health Literacy Alliance workshop that I ran said, first of all, it's all 3. Of course, it's all 3. All 3 are necessary, but we need justice. Health equity at the very base and also as an umbrella to protect these 3 domains. So that was such a great statement to make about health literacy. And so this final quote here from Kirsty Visser, a colleague from OsloMed in Norway. So I think that if all teachers and all public health nurses and health professionals leave higher education knowing about health literacy, it might help us to establish advocacy as a more central aspect of public health. So yes, health literacy is a health, education and community issue. Hopefully we've got that straight. It's also important that we call it health literacy. Lots of people say to me, don't call it that. People don't know what it is. Well, to them I say, I'm going to call it that and I'm going to advocate and ensure that people know what it is, what it means. And it's okay if we say it's health competence, but it's important that we make sure everyone's aware of this term and how important it is in their everyday life, but also in their family's life. There are so many more important observations and findings from this Churchill that I would have loved to have shared with you this evening, but it's not possible in the time that we have together. So my Churchill report is a collection of insights from my international peers. And so I want to acknowledge their input here. It's not just my work, it's the work of my peers. And in my Churchill report, you'll find some recommendations which can be grouped into 3 key areas. These are health in all policies, surprise, surprise, health literacy development in schools, and health and wellbeing economy. And now I'm going to unpack each of these for you. The first is health in all policies. My first recommendation, cross-sectoral coordination, multi-sectoral funding, strategies to overcome silos will be required. That's my first recommendation. These recommendations will be essential to a better Tasmania. I hope to also take them to federal government for discussion in 2024. And it would be great to see Tasmania and our ministers here adopt these before they go to federal government. Wouldn't you agree? Yeah. So with recommendations, it's helpful for people if we provide practical solutions, things to help us implement. So for that first one, I've suggested a number of practical solutions. We need to identify local, national and global champions. Government ministers must review their policies where appropriate to ensure that health has been included. We need to identify potential opportunities to improve health in all policies action, provide government staff in all sectors with professional development, and ensure government staff have opportunities to work with teams outside of their immediate department. The second theme was health literacy development in schools. I think in the background to this presentation, I've built up enough information for you to appreciate why it's so important we work with children in schools to develop the asset of health literacy. So the recommendations are, recommendation 2, a health in all policies approach is required to support health literacy development in schools. All sectors in Australia need to collaborate to ensure health literacy is being developed in schools. So it will require health, education and community to work together. More research and agreed measures or methods of assessment for children's health literacy will be essential, and that's where our research comes in. Teachers require training and resources to support health literacy development in their schools and classrooms. And our research shows that. The research we've done here in Tasmania, but also in the wider Australia and colleagues internationally, teachers need more confidence and skills to develop health literacy or develop health literacy in the classroom. Child and adolescent health literacy development requires advocacy, champions, social capital and change theory. So we need these teachers, principals and schools to be on board as well. That's really important. So just mindful of the time, I'm going to skip forward. So these practical solutions can be located in the report, so you can download the report later. Area 3 is around health and wellbeing economy. Remember that director I spoke about, Nicole Valentine, that I met with at the World Health Organization? She said, Rosie, this is all great, but it's not going to make much difference if Australia doesn't subscribe to a health and wellbeing economy. So in July, just as I was writing this report, the Australian government released the Health and Wellbeing Framework. Well, I had to delete some of the words out of my report and acknowledge this is the first step towards a health and wellbeing economy. And it's important that we focus on a health and wellbeing economy rather than just being focused on GDP. But we still have a long way to go in Australia. And so what I'm calling for in this recommendation 6 is a shift towards a health and wellbeing economy for the sake of the environment and the current and future generations. The importance of health literacy may be recognised by our society here in Australia if there was greater focus on health and wellbeing. Given health literacy is a social determinant of health and can be influenced, it can influence educational attainment, productivity and health outcomes, it should be considered an indicator for the health and wellbeing economy. So when that health and wellbeing economy rolls down, why not use health literacy as an indicator for how well Australia is performing on that? And again, you can refer to these practical solutions in my report. So what's next? Kitty's mentioned the Global Perspectives on Children's Health Literacy book. We've established a social enterprise entitled Health Lit for Everyone, and I'll explain why that's come about in a moment. I'll be applying for the Policy Impact Program through the Churchill Trust next year to take these recommendations to federal government. We will be applying for Australian Research Council Linkage Grant in partnership with Health Lit for Everyone. So our research group, the Health Literacy and Equity Research Unit, will partner with Health Lit for Everyone, which is a social enterprise, to deliver on an ARC linkage grant, so that this program and the health literacy of more Australian children can be developed. And I have many PhD projects. So if anyone in the audience is interested, please get in touch. We have 2 advertised currently. And I promise you'll enjoy working with our research team in the Health Literacy and Equity Research Unit. So I'm aware of the time, but I do want to circle back then to this Tasmanian Health Report card. I painted a grim picture, didn't I? And I don't like to be deficit. But what I want to highlight here is we have some solutions. Actually, we've got this silver bullet and it's called health literacy. Health literacy is a determinant of health. Let's throw it in there. Let's stop that process occurring. Even better, let's start earlier in the life course. Let's get these programs. Let's get children developing their health literacy in school. So, given the silos that we encountered, we've established a social enterprise. Remember those silos I was describing? Each time we applied for funding from health, they said, no, what you're doing is education. Go and talk to them. And talk to education. Actually, I think you'll find what you're doing is community. Go talk to them. So rather than giving up, we've established a social enterprise that is agile enough and can go across all. It enables us to access funding that we might not have otherwise been able to access. And I want to acknowledge the support of the UTAS Invent team who helped us to establish this. In addition to this, we've had many corporate sponsors or volunteers provide their time to us. So if you've got a skill set that you think Health Lit for Everyone could benefit from, please come and see me or email me. We're also looking for philanthropic donors as well to help us take this program to more schools in Australia. So I want to gratefully acknowledge the corporate volunteer hours that we've already received, and also acknowledge the work of the research team that's led to the development of this social enterprise, so that we can offer this service and support the health literacy of more children in communities in not just Tasmania, but also Australia. Kitty mentioned I've just come back from Taiwan. It sounds like some professors that I met with in Taiwan are very keen to see Health Lit for Kids adopted there too. So I'd love to see it adopted here in Tasmania before Taiwan has it. But let's just wait and see how the next few months pan out. Thank you for listening and thank you for being here. And I now hand back to Kitty.
Well, thank you so much, Rosie. That was absolutely fascinating. So I'm delighted that now we're moving into the Q&A part of the session. There's already some questions popping up on the screen. Karen has asked a question and she's saying, given the increased use of digital technologies to support and deliver health services and healthcare, did the idea of digital health literacy come up at all in your travels?
Thank you, Karen. Great question. Yes, some colleagues of mine in Germany, so Professor Orkan and also Kevin Dodansky, who may be listening this evening, have worked with Barmer, which is a big IT company, who funded their research, and they have developed a program for health literacy, but also digital health literacy, which has been rolled out in schools in Germany. Yes, so it's very much on the agenda and very much on our agenda. We wanted to really focus in on health literacy first and get that well established before moving into digital health literacy, because I think they do go nicely together and they are both important, but I wouldn't want to complicate matters or confuse things. So hopefully that helps to answer Karen's question.
Thanks so much, Rosie. There are a few hands up in the audience.
Thank you, Rosie. That was just a wonderful presentation. My question, what I'm curious about is, in a world filled with misinformation, whether your research has touched upon that as a barrier to health literacy, and if so, how can we set up health education in a way that really cuts through?
That's a great question. Thank you. Yeah, misinformation is difficult. And that's why it's really important for, firstly, the teachers to understand and be provided with professional development to help support them to understand the best places to find health information. Yeah, misinformation is always going to be there. And let's accept that that's a common thing. So that's why it's so important that we equip our children with the asset of health literacy so they can cut through that themselves. But also they can teach family members at home as well. So what we found in our research is there was a gentle backwash effect into the household. Children were taking homework home, their artefacts, their creative pieces home, sharing them with mum and dad. And some of the classes, the teachers specifically invited their children to focus on a health topic or an issue that they recognised in their local community or their children in their class as an issue. So some of the teachers specifically looked at misinformation and really got the kids to hone down in on that and look at different sources of information, decipher and decide which would be most appropriate to use. So, yeah, great question. And, yeah, so we did see it play out in the school. And the way the program is designed is so it's flexible. So we're not saying there's a one-size-fits-all and we've got a very prescriptive formula of how health literacy should be developed. It's with the teachers to look and see what their local community needs. So if they're seeing that, they've got an issue with vaping or smoking in their grade 5, 6 class, that might be the focus, and they develop health literacy using that as the topic, for example. And then another class might be specifically focused on food and nutrition, for example, so that they use the Australian Curriculum Health and PE theme areas to inform the development of the lesson plan. One of the things that's really interesting is in Australia, in that curriculum, which is a piece of policy, is that we say that health literacy is one of 5 guiding propositions. So it's here as an input. We don't actually measure or assess a child's health literacy as an outcome of that health education. So to me, that's a missed opportunity. And so what we'll be calling for in those recommendations is for a reform of education. And certainly in Finland and areas, other Nordic countries, they do look at health literacy as an outcome of health education. So we've got a real opportunity in Australia to think about that more and think about, well, how do we produce these health literate citizens? How can our education system work harder for us so that we don't end up with ramping down at the local hospital or these ridiculous amount of people experiencing chronic conditions?
Thanks, Rosie. Peter had his hand up there.
I'm a philosopher, and I was a little bit muddled by some of the conceptual framework that you were using. Let's assume that the goal of the whole enterprise is, crudely speaking, just for a tag, health. You've gone on at some length about how to achieve health literacy. What's unclear to me is whether that is worth aiming at rather than aiming at other elements in the means package that might lead to an end. And what it really cries out for is a longitudinal study.
Mm-hmm.
I understood that health literacy probably wasn't going to be a great element in producing the outcomes.
Thanks, Peter.
Thanks, Peter. So I think you've nicely highlighted how complex health literacy is and how many moving parts there are there. I think there was a few questions in there, so I'll just attempt to answer some of them. Yes, I wholeheartedly agree with you. We need a longitudinal study. And there has been a longitudinal study just published by Solis Trapper that highlights that a mother's or the parental health literacy can determine the child's health outcomes. We also have a number of other studies in the literature that shows the direct relationship between health literacy and health outcomes. So the literature tells us this. I've been meeting with professors both in Europe and also here, in Taiwan, and we've been talking about, you know, the childhood determinants of adult health data set that we have here, and there's a big consortium, international consortium, and there is an opportunity there to further explore health literacy as part of that data set. We happen to have the 40th year of the CEDAR program coming up, the 40th anniversary. So we'll be exploring some opportunities for looking at this further. But Peter, if you know anyone who has some funding that could enable us to do this longitudinal study, I'm totally there. I do believe it's a really important piece of work that we need to do. Yes, you are right. Health literacy, as I showed on the social ecological model, which some people would say also mimics Bronfenbrenner's model, which is an older model. I think health literacy of an individual is just as important as creating those enabling environments around that individual. We need to do both. So it's not a one or other thing. We need to do both. There's also many other determinants which I showed on the screen that are influencing us, and those upstream causes that are outside of our control. But if there's one that we can control, which is health literacy, and we can develop it in schools, why wouldn't we do that?
There's a really nice follow-up question to that online. So I'll just go to the online question, but I noticed there's more questions in the audience. And the question online, it's from an anonymous person, but it's saying, you mentioned that you're hoping to apply for some impact funding through the Churchill Fund as well, the Churchill Trust. What are you hoping to achieve with that?
So the policy impact program through the Churchill Fellowship enables you to work with policymakers directly. I plan to, and I've already spoken to the Public Health Association of Australia, to bring in some key people to prepare a recommendation or a submission to take to federal government. What I hope to achieve, it's a great question, is raised awareness of the importance of health literacy, but also to ensure that every child in Australia has an opportunity to develop health literacy. So one of the things I didn't say earlier is the reason this program came about was I recognised in my own children who were born to two pharmacists, they had an unfair advantage over other children who didn't have people at home supporting them to develop their health literacy assets. If it's not happening at home, where else could it happen? In schools. Schools are a really important place where we can equalise the playing field. We can cut that inequity out, provide children with the asset of health literacy. We do have a paper that looks at the ethics of this, describes and talks through why it's such an ethical imperative that children, and it's actually part of the child's rights. So it's really important that we support children to develop this asset of health literacy. I hope that's answered the question. Yeah.
Thank you. There was another question here in the room.
Thank you. Your most recent comments, I think, prefigured what I wanted to say, because it's a matter of resources. And I believe that people in the relevant fields, medical people, health people in certain areas, teachers very definitely. I'm a retired high school principal, and they would know where the greatest need is. But I believe if you're going to achieve most of your aims, you're going to have to start with greater inequity of funding to ensure that the equity goes right down to the most needy areas. Very simply, in our democracy, the demand is for equity in everything, especially in the distribution of resources. So we have private schools, for example, one mentioned in the Mercury today, where the fees are $38,000 a year. yet they still get large dollops of public, federal and state money. And whereas the government schools right around the country on average are about $2,000 per student below what was agreed on the Gonski reports of about 14 years ago. And I would want to know whether you would advocate for inequity of distribution to concentrate on those lower groups, to call them lower.
So yes, 12 months ago, I could have rolled this program out to the private schools. Easy. But actually, one of our guiding principles is to be equity driven. We're waiting for those philanthropic donors to come forward to ensure we can offer this program to those children that really need it most. So that is why the social enterprise had to be set up, and that's taken at least 3 years to do. It's been a lot of work in the background. I don't know if you've formulated a constitution and put it through legal processes, but it does take a long time. So this is why the social enterprise is important. The other thing that we've talked about is the idea of a school, like a collegiate or a Hutchins or a private school, supporting, if they were to take the program, supporting another school who may not be able to afford it. And this is, again, why the social enterprise structure and model is so important. So I believe, actually, we can address that inequity, and the social enterprise structure will be essential, but it will require those philanthropic donors.
Thank you. I've got one more question online, but we've only got a tiny amount of time for you to answer it, but it's such a lovely question. It's from Christine, who says, thank you for a great presentation. But then she says, how can we strengthen the ties between Tasmania and Europe to keep learning from each other?
Well, I think we've got a strong tie already. We've got an International Health Literacy Association conference in Rotterdam next year, I understand. Many of our health literacy and equity research unit hope to attend, and we'll be sharing the Tasmanian research that's being undertaken here at the University of Tasmania at that conference. And I have great aspirations, and I'll be talking to the Department of Health here in Tasmania and also the University of Tasmania of hosting the International Health Literacy Association conference in 2018. And I've already spoken to the president of that organisation, who said, yep, raise the funds and you can have it in Tasmania. So let's put Tasmania on the map and let's get the International Health Literacy Association conference here in 2018.
Well, I think we can all agree that Rosie Nash here is putting Tasmania on the map in terms of health literacy. Please join me in thanking Rosie. And it has been such a pleasure and such an honour to host your presentation tonight, Rosie. And I'm sure Rosie's presentation will inspire ongoing conversations beyond this space and beyond tonight. And as you continue to talk with each other, with your friends, your family, your colleagues, that means that you're taking Rosie's vision for the state and indeed for the world into your community and bringing it to life. And that's a small role that all of us can play to contribute to the future health of our community. Now, we hope to see you all again at our next event, which is on the 6th of December. Again, you can join online, or it will be in the Stanley Burbury Theatre in Sandy Bay. We will have developmental psychologist Professor Melanie Zimmer-Gembeck, who will be discussing parenting in an unsteady world. So please join me again to show appreciation for tonight's speaker, Dr. Rosie Nash, and indeed for the Island of Ideas team. And on behalf of the University of Tasmania, thank you and good night.